Order. Call the Minister for COVID vaccine deployment to make a statement, Mr. Nadhim Zahawi.
Thank you very much, Madam Deputy Speaker. Can I begin by thanking you, and with permission, I'd like to make a statement on coronavirus. But before I do that, I'd like to wish my shadow opposite number a happy birthday today. Our nation, Madam Deputy Speaker, is getting safer every day as more and more people get protected by the biggest immunisation programme in the history of our health service. Over 10 million people have now received their first dose of one of our coronavirus vaccines. This is almost 1 in 5 adults in the United Kingdom. We're vaccinating at scale, while at the same time retaining a close focus on the most vulnerable in our society to make sure those at greater risk need are at the forefront of the queue. I am pleased to inform the House that we have now vaccinated almost 9 in 10 over 80s in the UK, almost 9 in 10 over 75s, and over half of people in their 70s. We've also visited every eligible care home possible with older residents in England and have offered vaccinations to all their residents and staff. This means we are currently on track to meet our target of offering a vaccine to the 4 most vulnerable groups by mid-February. This is an incredible effort, Madam Deputy Speaker, and has drawn on the hard work of so many. And I want to just take a moment to thank every single person who has made this happen, the hundreds of thousands of volunteers up and down the country, the scientists, of course, our colleagues in the NHS, the GPs, the doctors, the nurses, the vaccinators, social care, the manufacturers, the local authorities, the armed forces, the civil servants who work night and day to make this deployment possible, and anyone else who has played a part in this huge logistical endeavour. It really is a combination of the best of the United Kingdom. At our time of national need, you have given us a big boost at our fight against this deadly virus, which remains a big threat to us all. There are still over 32,000 COVID patients in hospital, and the level of infection is still alarmingly high. So we must all stay vigilant and keep our resolve, while we keep expanding our vaccination programme so we can get more people protected even more quickly. Madam Deputy Speaker, we have an ambitious plan to do this. We're boosting our supply of vaccines, and our portfolio now stands at over 400 million doses, some of which will be manufactured in the United Kingdom. And we are opening more vaccination sites too. I'm pleased to inform the House that 39 new sites have opened their doors this week, along with 62 more pharmacy-led sites. This includes a church in Worcester, Selhurst Park, the home of Crystal Palace Football Club, and a fire station in Basingstoke, supported by firefighters and support staff from Hampshire Fire and Rescue Service. One of the greatest pleasures, Madam Deputy Speaker, for me over the past few months has been seeing the wide range of vaccination sites that have been set up right in the heart of our local communities. Cinemas, mosques, food courts, and so many other institutions have now been transformed into life-saving facilities, giving hope to people every day. Thanks to this rapid expansion, we have now established a major national infrastructure. There are now 89 large vaccination centres and 194 sites run by high street pharmacies, along with 1,000 GP-led services and over 250 hospital hubs. Today's announcement will mean that even more people will live close to a major vaccination site, so we can make vaccinating the most vulnerable even quicker and even simpler. Madam Deputy Speaker, we have always believed in the power of science and ingenuity to get us through this crisis, and I was pleased earlier this week to see compelling findings in the Lancet Medical Journal reinforcing the effectiveness of our Oxford AstraZeneca vaccine. It showed that the vaccine provides sustained protection of 76% during the 12-week interval between the first and second dose, and that the vaccine seems likely to reduce transmission to others by 2/3. This is, of course, really great news for us all, but we will not rest on our laurels. Madam Deputy Speaker, no one is really safe until the whole world is safe. Our scientific pioneers will keep innovating so we can help the whole world in our collective fight against this virus. I saw how wonderful and powerful this ingenuity could be when I was one of the thousands of volunteers who took part in the Novavax clinical trial, a trial that published very promising results a few days ago. Today, I'm pleased to announce another clinical trial, a world-first study that will help cement the United Kingdom's position as a global hub for vaccination research. This trial will look at whether different vaccines can be safely used for a 2-dose regime in the future to support a more flexible program of immunization. I want to just reinforce, Madam Deputy Speaker, that this is a year-long study and there are no current plans to change our existing vaccine program, which will continue to use the same doses, but it will perform a vital role, helping the world understand whether different vaccines can be safely used. Our scientists have played a pivotal part in our response to this deadly virus, and once again, they are leading the way, helping us to learn more about this virus and how we should respond. Madam Deputy Speaker, it has been heartwarming to see how excited so many people have been to get their vaccine and to see the work taking place in local communities to encourage people to come forward to get their jab. Honourable members, of course, have an important role to play too. I was heartened to see colleagues from all sides of the House coming together to encourage take-up within minority ethnic communities through a joint video which was posted on social media last week. 2 videos, I should add. The video rightly says MPs don't agree all the time, but on taking the vaccination, we do. I could not agree more, and I am grateful to every single honourable member who has come forward to support this national effort. We want to make it as easy as possible for colleagues to do so. This week, we published a new resource for honourable members that provides more information on the vaccine rollout and what colleagues can do to increase the take-up of the vaccine in their constituencies. This is an extremely valuable resource, and I would urge all honourable members to take a look at and think about what they can do within their constituencies. Madam Deputy Speaker, our vaccination programme is our way out of this pandemic, but even though this programme is accelerating rapidly, and as the Chief Medical Officer said yesterday, we appear to be past the peak, this remains a deadly virus, and it will take time for the impact of vaccinations to be felt. So for now, we must all stand firm, keep following the steps that we know make a real big difference until the science can make us safe. And I commend the statement to the House.
Thank you. Happy birthday to the Honourable Member for Nottingham North. Mr. Alex Norris.
Thank you, Madam Deputy Speaker. I'm grateful to the Minister for advance sight of his statement and for his kind words about my birthday and for yours as well. But of course, the gladdest tidings is the news that more than 10 million people have received their first dose. Once again, our incredible National Health Service has delivered for us. And I visited a site in Nottingham earlier in the week, and to see that team of the NHS, armed forces, local councils, volunteers and many more coming together was really an uplifting and a really incredible sight. And we welcome today's announcements about the new clinical trial. It is clear that we will live with COVID-19 for a long time, and indeed its mutations. So this is the best way to get out in front of it. And we were very glad also to hear the study results regarding Oxford AstraZeneca vaccine, reducing transmission and maintaining protection over 12 weeks. Again, as the Minister says, it's very clear that vaccines are the way out of this pandemic. Daily cases are now beginning to fall, but it is vital the government doesn't repeat previous mistakes and take the foot off the gas just as things look to be getting better. I wonder whether the Minister could update us on if he expects similar trial data to be published for the Pfizer vaccine. The government seems on track to deliver on its promise of vaccinating the top 4 JCVI priority groups by the middle of this month, and we really welcome this, and I commend the work of the Minister in this regard. But in the spirit of cooperation, just need to press on a couple of points about what comes next. Firstly, regarding data, we're all very concerned about the reports of lagging take-up amongst Black, Asian and minority ethnic communities, as well as poorer communities. And I would associate myself with the comments about the brilliant work done by our colleagues to fight this. Because what we know about the pandemic is that it's these groups that have been worse affected. We need them to take up the vaccine. But I'm conscious that much of what we hear is based on anecdotal stories rather than hard data, particularly at a community level, split by ethnicity. I wonder whether the Minister could say what data he has in this regard and when colleagues can get council ward level data so that we can all be part of this effort to drive up take-up. And also, as the first phase is coming to an end, could the Minister update on the number of care home staff who have received their first dose and what the plan is, perhaps to encourage those who haven't to take it up upon second reflection? And regarding second doses, when we get to the beginning of April, we'll start to have those who have their first dose expecting and needing their second one. So what assurances could the Minister say around there being enough supply to ensure that everyone who's due their second dose gets it, as well as obviously managing those who are due their first one? The Foreign Secretary wouldn't offer this commitment on behalf of the government recently. I hope the Vaccine Minister will be able to. Colleagues have raised with me that constituents who have received a national letter and called 119 to book are not routinely being offered local PCN-based options. Could the Minister confirm that this should not be the case and that he would welcome examples of where this is happening so that we could change that? Now, we as an opposition fully supported the government prioritising those at the greatest risk of dying in those first four categories. But as we move on to categories 5 to 9, it is reasonable to ask the JCVI about including key workers. Data has shown that those who work closely with others and are regularly exposed to COVID-19 have higher death rates than the rest of the population. By prioritising these workers alongside the over 50s, 60s and people with underlying health conditions, we can reduce transmission further, protect more people and keep the vital services that they're providing running smoothly, including reopening of schools. So putting the politics of this to one side, we raised this suggestion over a week ago now. Could the Minister say whether he has had those conversations with the JCVI or if he would at least commit to asking them to look at how this might work as a suggestion? Madam Deputy Speaker, it is HIV testing week. Those living with HIV are in category 6. If their doctor knows their HIV status, then they will have their opportunity as planned. However, some choose perfectly legitimately and for some very profoundly important reasons to access their healthcare through other means, such as an HIV clinic. And their doctor, therefore, may not know their status, and they may well be missed out. In this very specific case, would the Minister commit to having a look at what may be a possible workaround this? Allowing HIV clinics to connect them directly would be one such way, but we would support any effective way of doing that. And then finally, given that it's World Cancer Day, I wonder what consideration the Minister has given to vaccinating household members of the clinically extremely vulnerable to give another layer of protection to blood cancer patients and other CEV people, an argument I think strongly supported by the reports that transmission is reduced by these vaccinations. So to conclude, Madam Deputy Speaker, this programme really is the light at the end of the tunnel. Our NHS has delivered and we must support it to continue to do so by making the right policy decisions. Thank you.
Minister.
Thank you, Madam Deputy Speaker. I'm grateful for the honourable gentleman and his constructive way of engaging with the vaccination deployment programme. On trials, we have 2 trials running currently. The Vivaldi trial, both with Public Health England, which is testing residents of care homes, which were in category 1 of the JCVI categories, and the second is Siren, which is testing frontline health workers who are in category 2. And as Jonathan Van Tam, the Deputy Chief Medical Officer, said, we will know in the next few weeks the data from those trials, both in terms of infection and transmission. And of course, the Oxford data is very promising. It needs to be peer reviewed. But those trials will then also capture the Oxford vaccine, because obviously that came from on side in January. In terms of the priority list, the JCVI looked very closely at both BAME and, of course, other considerations, including profession, and came down very clearly on the side of age as the deciding factor in terms of people's risk of dying from COVID. This is a race against death, hence why we've got the 9 categories which we are going through, and we will continue to do so. Now, a number of professions will be captured in those categories. Of course, those who have severe, extremely severe illness will be captured in category 4, the severely, extremely vulnerable. And then, of course, others will be captured in the further categories down the phase 1 list. I certainly think it would be wrong to change the JCVI recommendation, because that 1 to 9 is 99% of mortality. I think when we get into phase 2, then we would welcome a debate, and of course ask the question of the JCVI as to whether professions like teachers, like shop workers, like police officers, who through their work will come into contact with much greater volumes of the virus than others do, and they will then advise us accordingly. On BAME and ethnicity, the NHS now collects the obviously ethnicity data, and we're publishing it. We're doing an enormous amount of work across government, but also with the NHS, to make sure we bring in local government so that we can begin to share data with local government. And I, for one, would very much welcome us working much more closely with local government, between the NHS and local government, so that we can identify, to individual level, the people that we need to reach to protect as soon as possible. I want to see CCGs sharing data with MPs. I want to put that on record. I've had a number of colleagues who, including, I can see Madam Deputy Speaker, nodding away vigorously. The CCGs should and must engage with local politicians, because actually MPs get a lot of the emails and the telephone calls from concerned constituents who happen to be in those top 4 most vulnerable categories. And of course, the NHS has plans to publishing CCG level data very soon. In terms of care home staff, he asked about, we had a fantastic response, obviously, through the care home vaccination program, which is because it's category 1. And we continue to do more with staff to encourage them to be vaccinated, not just on the return visits, because we have 4 visits into care home. Visit 1 is for the first dose. Visit 2 is to try and vaccinate those who may have been infected, because you can't vaccinate them until after 28 days. And visit 3 would be second dose, and so on. So we're getting greater traction with care home staff, but he's quite right to mention that there's a big focus on helping them go to hospital hubs, and of course through their primary care networks. In terms of second dose, everyone who's had a first dose of Pfizer will get a second dose of Pfizer within that 12-week dosing period. It'll begin in March in the usual way that NHS does vaccination. This will also happen. Everyone has had a first dose of Oxford AstraZeneca will get a second dose of Oxford AstraZeneca within the 12 weeks as well. In terms of people wanting to the option of either going to a national vaccination centre or to PCN, absolutely right. And if there are cases that honourable members have, please point them to us, and we will do everything we can to make sure that that is facilitated if they're unable to. On his, I think rightly highlighting the HIV clinics, I will take that away and see whether we can, there's a workaround for those who want to remain, have that information remain private from their GP, then we see what we can do. And again, I would share with him that this is World Cancer Day, and there's now a real excitement in the scientific community in the UK because of the messenger RNA vaccine to begin to think about vaccines for cancers as well. But he raises an important point about those who care for the clinically extremely vulnerable. And we want to make sure that we deliver the JCVI phase 1 and very quickly reach the rest of the population as well.
Now we go to the chairman of the Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. And can I congratulate the Minister for his leadership of the vaccine rollout programme, which really is one of the most impressive anywhere in the world, and indeed commend the Health Secretary for the foundations that he laid for this last year. I wonder, now that we know that mutations and variants are really the name of the game, if I could ask him about a worst case scenario, which is that we see a variant that is wholly immune to the vaccines that we are currently distributing. How possible is it that we could see that in the next few months in the UK? Has the Manaus variant from Brazil, which I know people are particularly worried about, arrived here? And if we did see such a variant, what is the timescale, not just to develop a new vaccine that works against it, but also to manufacture it and get it approved by regulators so that it's ready to go?
Minister.
I'm grateful for the chairman of the Health Select Committee and his question. He's absolutely right. So the manufacturers are already working on variants to their vaccine to take into account the mutation of the virus. Viruses will mutate to survive, and this virus is no different. There are about 4,000 mutations now around the world, some more concerning than others. We have in the United Kingdom a genome sequencing industry that is a world leader. About 50% of the sequencing has taken place just under in the United Kingdom. And not only are we working with the current manufacturers of Pfizer-BioNTech and, of course, AstraZeneca and Moderna that have been approved, but we're also looking at how we can make sure that we make the most of this new messenger RNA technology, which allows us the rapid development of vaccine variants that will then deal with the virus variants as rapidly as possible. And I spoke to the Science Select Committee a few weeks ago when I said we were planning to have in place the ability to go from the moment we can sequence a variant that we are really concerned about to the moment we can have a vaccine ready, to be between 30 to 40 days, and then of course the manufacturing time. We've invested in both Oxfordshire in the VMIC, the Vaccination Innovation Manufacturing Centre, and in CGMIC in Braintree, 127 million in there, just shy of 100 million in Oxfordshire, to be ready to manufacture any vaccine that we would need. And of course, the Prime Minister also visited what I refer to as our 7th vaccine, which is the Valneva vaccine. That's a whole inactivated virus. So it doesn't just work on the spikes in the way the current 2 vaccines that we are deploying works. It works on the whole of the virus, which is much more likely then to capture any mutations from the spikes and therefore be incredibly effective. We've invested in that production facility in Scotland so that we can have that vaccine as a future proofing of sort of annual vaccination strategies or a booster in the autumn if necessary.
Thank you. Now we go to the SNP spokesman, Neil Hanby.
Thank you, Madam Deputy Speaker, and I thank the Minister for the advance sight of his statement. I'm glad to hear the Minister's recognition of the importance of adherence to the clinical categories of the JCVI, and I would also like to give my thanks on vaccination teams in my Kirkcaldy and Cowdenbeath constituency across Scotland and indeed these islands. However, I would urge the Minister to think more lightly of himself and deeply of the world. Over recent weeks, the UK government and their allies in Scotland have quite disgracefully been attempting to sow fear in the minds of our vulnerable communities that vaccine deployment is too slow. That narrative was completely debunked yesterday, yet the PM still claimed we have today passed a milestone of 10 million vaccines in the United Kingdom, including almost 90% of those aged 75 and over in England, and every eligible person in a care home. However, today on Good Morning Scotland, the Undersecretary for Vaccine Deployment was further pressed how many vaccines have been given, not offered, but given to people in care homes in England. Even with 24 hours warning and following a detailed probing, he was not able to offer more than a vague 91% of those eligible in an ill-defined subset before settling on a very high number and suggesting care home staff's vaccination may not have yet begun in England. Can the Minister tell us today what percentage of all care home residents and all care home staff have had their jab in England, and if not, why not? And Madam Deputy Speaker, I would like to return to the JVCI clinical prioritization, if I may. In a recent written parliamentary question to the Minister regarding the clinically extremely vulnerable, he chose to regurgitate JCVI guidance rather than answer the question. With the encouraging news that the Oxford vaccine and potentially others have a measurable impact on transmission, Can the Minister update the House on what steps he has taken to ask the JCVI to review current guidance for household members of the clinically extremely vulnerable, such as people with blood cancer or organ transplantation, and thus provide a vital layer of protection to those who may not be able to receive the vaccine themselves?
Minister.
Thank you very much, Madam Deputy Speaker. I'm grateful for the honourable member's question, albeit I don't recognise his description of our collaboration, dare I say. We have, over the past 2 weeks, been working solidly. The British Army, the armed forces, have been working to deliver 80 vaccination sites in Scotland and hand them over to NHS Scotland within 28 days. And that work began a couple of weeks ago. So I hope he recognises the effort that the United Kingdom is putting, not just in supplying the vaccines for Scotland, for Wales, Northern Ireland, and for England, but also the way we're trying to support the vaccine deployment in Scotland. Of course, last weekend was our target to make sure that every eligible care home in England, over 10,000 care homes, have actually been visited and received the vaccine. Only a handful of care homes who had were deemed to have an outbreak weren't visited, and we did the NHS quite rightly celebrated actually achieving that target last weekend. So I'm slightly saddened in a way that there's this sort of politicking between ourselves here around this issue. And we continue, as the Shadow Minister just asked me, to work very hard to make sure that staff in care homes are also offered the vaccine on those visits, and also actually an opportunity to be vaccinated in their primary care networks and, of course, in hospitals. As far as the JCVI, those who are clinically extremely vulnerable are in category 4, and we will vaccinate them by mid-February.
Now we go to Scunthorpe, to Holly Momby-Croft.
Thank you, Madam Deputy Speaker. Will my right honourable friend join me in thanking local health teams and volunteers for their incredible vaccination efforts that we've seen in North Lincolnshire? I know they are keen to deliver even more. Can he give an update on the progress he is making on increasing weekly vaccine supplies? Thank you.
Yes, sir.
For my honourable friend's question, I will certainly join her in thanking the teams that have been working in North Lincolnshire and delivering. These are extraordinary people doing really incredible work, and I want to thank them from the bottom of my heart. We try as hard as we can in the team to make sure we give as much notice to local teams as to when they're getting their delivery. So this week, yesterday, Wednesday, everyone would have had notice of their deliveries for next week. We want to give as much notice as possible. Our limiting factor remains vaccine supply. It is becoming more stable. We have greater visibility of vaccines all the way through to March, hence why our confidence in meeting our targets. I can reassure her that her local teams will get the vaccines they need to meet the mid-February target of vaccinating the top 4 cohorts for that date and protecting them.
Now we go to Twickenham, to Munira Wilson.
Thank you, Madam Deputy Speaker. It was an immense privilege to visit the Stoop in Twickenham this morning, home to Harlequins Rugby, which opens today as a local mass vaccination hub. The NHS, Quins and the Council have done an incredible job to be in a position to start vaccinating 500 people a day. The Minister has spoken quite a lot about care home staff and some of the challenges in driving uptake among those staff, but we know that domiciliary care staff are also lagging behind in terms of vaccination rates. One industry survey suggested only 32% had been vaccinated so far. So can I press the Minister again, what are the latest vaccination rates for both care home staff and home care staff? What are the reasons for this lag, and how can we best work together to address this problem?
Minister.
I'm grateful for the honourable lady's question. It's great to hear the Harlequins joining the fight, as they always do, when it comes to the United Kingdom actually getting people protected and vaccinated. The care home and domiciliary staff are both in our priority list, as she knows. We are working with local government, and David Pearson, who is a champion, of course, of the social care sector, has been working with local government to identify the best way to identify domiciliary staff is through local government, because a lot of people will be with agencies, and as you quite rightly pointed out, hard to reach. They are in our target. They are part of the top 4 categories with those who are caring for the elderly in residential care homes, and we will meet our target of offering them a vaccine by mid-February.
And now to Wrexham, Sarah Atherton.
Thank you, Madam Deputy Speaker. British-based pharmaceutical companies have been pivotal in the global fight against this pandemic. Plants in Teesside, Livingston, Oxford, and Wockhardt in my constituency of Wrexham are central to the vaccine manufacture. So what conversations has my honourable friend had with his Home Office counterparts to provide sufficient security to these vital national vaccine infrastructures?
Minister.
I'm grateful for my honourable friend's question. I just want to reassure her that through the Vaccines Task Force, we've been liaising extensively with the vaccines developers and the related organisations to ensure that the highest level of security exists through the whole vaccine deployment chain. This has included, of course, working directly with the manufacturers, and we have a senior responsible officer seconded to the team to make sure that security is absolutely at the forefront of everything we do to deliver this program. We cannot allow a lapse in security to get in the way of the largest vaccination program in the history of this country.
Jim Shannon.
Thank you, Madam Deputy Speaker. And can I thank the Minister for his concerted strategy and for the overall rollout of COVID vaccine. We are deeply indebted to the focus that the Minister has given. Can I ask the Minister as well to confirm whether he intends there to be a route by which those who are younger and still attending work, which is front-facing, and are able to access their vaccine, and further, what coordination has there been with GP surgeries to assist them in categorising need when it comes to assessing those who are vulnerable but who didn't have the shielding CEV letters? Thank you.
Minister.
I'm grateful for my honourable friend for raising this issue. It is a priority for us, and we'll be saying more on that very soon, because those are the groups that haven't received the letters shielding, but they remain incredibly important. He's absolutely right to raise it, and it is something that is a priority for us.
And now we go to Eastbourne, Caroline Ansell.
Thank you, Madam Deputy Speaker. 10 million vaccines is a major milestone and a serious achievement, and I'm very pleased to report to my honourable friend that thanks to the dedication of many local people, the rollout in Eastbourne has got off to a very strong start. But as access and options have increased with new sites coming on stream, there has been some initial public confusion over the different routes and communications. The concern is that the did not attend rate, which has been to date insignificant, could now increase. Can I ask my honourable friend, who is doing such sterling work, to assure me that as we march forward, the structure of this brave new campaign, vaccine campaign, is being reviewed and that we can have confidence?
I'm grateful to my honourable friend and her question. I'm delighted to see that in her constituency, the vaccination programme has rolled out so efficiently and so well. She's absolutely right to point out the issue of choice. It was deliberate that we wanted people to have the choice to be able to go to either a vaccination centre or through their primary care networks or hospital hub. I will absolutely make sure that each and every person in those 4 categories are offered a vaccine. We have a strategy which we are now implementing because we're so close to that deadline of reaching out to granular levels to GPs to essentially go through exactly the population in each of those 4 categories to make sure that we know everybody's been reached and everybody's been offered that vaccine. So I would just give her that reassurance.
Now we go to York, to Rachel Maskell.
Thank you, Madam Deputy Speaker. Pharmacies cannot contribute in the vaccine programme unless they commit to deliver at least 1,000 vaccines a week. This precludes many community pharmacies embedded within those communities where some residents cannot access the vaccination centres. So will the Minister allow local pharmacies to work together to deliver smaller volumes so that they can reach more residents who would not otherwise get a vaccine?
Minister.
I'm grateful for the Honourable Lady's question, and community and independent pharmacies have a significant role to play, as you may have heard me in my earlier remarks refer to the hundreds who are already in the programme delivering vaccines. The reason for the 1,000 vaccinations a week minimum is because when vaccine supply is finite and every dose matters, what we can't afford is for vaccine just to sit in a fridge in a smaller pharmacy, hence why that requirement. As vaccine supply begins to improve, then we can look at bringing in more pharmacies. At the moment, 98% of the country is within 10 miles of a vaccination site. 2% we will go to them with a pop-up site. I want us to be at a stage, once we've done phase 1, maybe to get to being able to be more convenient, where people can pop into their local pharmacy once supply allows.
And now to South Dorset, Richard Drax.
Thank you, Madam Deputy Speaker. The data concerning the Pfizer vaccination recommended that the second jab be given within 3 weeks. As the Minister has said today, it's currently 12. I'm hearing of concerns from the medical world about this gap, which it's claimed risks reducing the vaccine's efficacy. Could my honourable friend update the House on this matter?
Minister.
I'm grateful to my honourable friend for his question. Pfizer themselves say that it is up to the national regulatory authority to essentially advise on the dosing interval. And so not only the MHRA, which is our regulator, but the Joint Committee on Vaccination and Immunisation and the 4 chief medical officers of England, Scotland, Wales and Northern Ireland all agreed that the up to 12-week interval for Pfizer-BioNTech is exactly the right thing to do to make sure we protect as many people as possible, including, of course, citing Pfizer's own data that after 15 days, up to 21 days, protection is up to 89% with the first dose.
We now go to Hammersmith. Andy Slaughter.
Thank you very much, Madam Deputy Speaker. One of my main primary care centres only has enough vaccine supply to open for half a week. Whether this is because vaccines are being directed to other types of centre, like the major centres, which we do not yet have, or are bypassing London, or there is simply not enough vaccine full stop, targets are being missed. Only 70% of over 80s and 55% of all priority groups have been vaccinated by this week. Can the Minister look at supply to Hammersmith and Fulham and to London generally?
Minister.
I'm grateful for the honourable gentleman's question. I will certainly have to take a look at the specific example if he is able to get me the details. The data that will be published at 2 p.m. For his STP will show that the over 80s are now at over 75%, which is an improvement, but they need to go even further. So I'll happily take a look at that. And of course, the recent large vaccination site opened at Network House, Wembley, will also help there.
And now we go to Dewsbury, Mark Eastwood.
Thank you, Madam Deputy Speaker. Frontline nurses, doctors and care staff in Dewsbury, Mirfield, Kirkburn and Denby Dale have done an amazing job throughout this pandemic, working long hours under immense pressure, and it is only right that they have been included in the first phase of the vaccinations. Could my right honourable friend confirm the percentage take-up rate of vaccinations for NHS and care home staff?
Minister.
I agree with my honourable friend for Dewsbury. The fantastic NHS staff have stepped up in the most challenging of circumstances, and it is imperative that they are part of this first phase of the vaccination programme. A significant milestone has been achieved last week, as you heard me say earlier, as we have now gone into every eligible care home of older adults to offer their staff and residents their first dose of the vaccine. This is absolutely, I think, testament to our remarkable care home staff and NHS workers. I would urge all social care and frontline healthcare workers to take up the vaccine when it is offered to them. Recent large, obviously, vaccination centre in his constituency is the Spectrum Community Health CIC in Wakefield, which staff can also access. We continue to make progress with staff, and our aim is to offer to each and every member of staff that vaccination by the middle of February.
And now to Bristol, Kerry McCarthy.
Thank you, Madam Deputy Speaker. The news that a mutated form of the new, more infectious Kent variant has been found in Bristol has worried a lot of people. And I appreciate what the Minister said earlier about developing new variants of the vaccines as we go along. But where does that leave people who've already been vaccinated or will be vaccinated before those new vaccines come on stream? What reassurance can the Minister offer?
Minister.
Mr. Speaker, the Honourable Lady raises an important point. The current vaccines that we are deploying will work on the variants that are in the United Kingdom. Both the Deputy Chief Medical Officer, Jonathan Van Tam, and the Chief Scientific Advisor have said that they'll be very surprised if the current vaccines have no impact on the variants of the virus. So we continue to vaccinate at speed, at the same time, of course, being vigilant by sequencing the new variants and, of course, being able to react with the manufacturers to any future need in terms of the vaccination program. At the moment, the vaccines are exactly the right thing to do, including, of course, protection from severe infection and hospitalization, which remains incredibly high with both vaccines.
Now we go to Gillingham, Raymond Chishti.
Thank you, Madam Deputy Speaker. Further to my question to the Prime Minister last week, calling for a mass vaccination centre in Medway, along with fellow Medway Members of Parliament, I welcome the proposals by Kent and Medway CCG to increase capacity at Medway Hospital, which now needs to be added to the National Booking Programme. However, the Minister knows from conversations with Members of Parliament for Medway that we urgently need a mass vaccination centre in Medway. We have a population of 280,000 in Medway. We are one of the hardest hit areas with COVID in the country. I need the Minister now urgently, please, swiftly and quickly to ensure we get a mass vaccination centre in Medway in line with our needs. And linked to that, will you join me in paying tribute to the fantastic NHS staff across Medway, Medway Hospital, and the great work the CCG are doing in Kent?
Minister.
I'm grateful for my honourable friend, and he and I have had conversations about this, as he is a great champion, of course, of his constituents. He will be aware that there's been a huge amount of work to step up vaccination services in Medway in recent weeks. Each primary care network site receives their own, of course, supply, and work has been carried out with the local CCG to ensure that vaccine supply aligns with the number of registered patients in the priority cohort groups, the 1 to 4. Where sites may progress through their supply more quickly than others, what we've done is to make sure that we're working with the site to ensure that the supplies are replenished to continue vaccinating the most vulnerable as quickly as possible. And we're keeping a very close eye, of course, on his area, because he quite rightly points out it has gone through some difficulties, but I can reassure him that the number I have, the latest number for the Kent and Medway STPs, 86.3% of over 80s have had the first dose.
Thank you. Now we go to Motherwell. Marion Fellows.
Thank you, Madam Deputy Speaker. The Leader of the House and the Minister talk of the beneficence of his government. Yesterday, soon-to-be Baroness Davidson asked Scotland's First Minister if she would accept armed forces help with vaccine deployment in spite of huge increases in rollout in Scotland. As Scotland contributes towards UK armed forces, as do all parts of the UK, isn't it time to stop using this dreadful pandemic to portray the deployment of our armed services in such a cynical and divisive way?
Minister.
I'm grateful for the honourable member's question, although I'm slightly surprised. It is the United Kingdom's armed forces and it is the United Kingdom's vaccine that is being deployed. I hope we can celebrate that. And I see my honourable friend across the dispatch box actually nodding, and I think he's smiling underneath that mask as well.
And now to Chatham, Tracy Crouch.
Madam Deputy Speaker, may I join others in congratulating the Minister in the incredible world-leading rollout of the vaccine. I would have expected nothing less from my brilliant friend and colleague. But can I also reinforce my Gillingham colleague's plea for a Medway Vaccination Centre for all the reasons that he gave, and maybe it'd be helpful if we could meet with the Minister to discuss the need in more detail. Madam Deputy Speaker, my PCNs are doing a phenomenal job at racing through the top 4 priority groups, but at present they don't have access to IT systems such as Outcomes for Health or the Foundry, enabling them to analyse and plan properly. My understanding is that access was promised but may not have universally happened. So could the Minister reassure the House that this is being urgently rectified to support the next and larger phase of vaccination rollout?
Minister.
Thank you very much, Madam Deputy. I absolutely would like to add my thanks to those of my honourable friend for the relentless determination of her excellent local PCNs in vaccinating those who are most vulnerable. And I'd be very happy both to meet colleagues to go through in detail the plan up till mid-February, because that's our target, and then beyond that as well. I'd also be very happy to take away the specific concerns of her PCN in terms of data sharing. Our mantra in the team is to make as much data available as quickly as possible when we know it's robust and actionable. So we will look at her point around Foundry and, of course, the Outcomes for Health to make sure that we are able to share that. I want to make sure that we get to a stage where every PCN can track their order in the way you can track your order on Amazon. That is the aim, because that's the way, we've reached base camp, Madam Deputy Speaker, but we've got a big climb to vaccinate the whole nation.
And now to Blaydon. Liz Twist.
Thank you, Madam Deputy Speaker. And can I start by thanking all the staff in our primary care networks and in our NHS for the magnificent work they've done to make sure as many people in the priority groups in the North East are vaccinated. Now, in any call and recall system for vaccines, there will inevitably be people who are missed out. So when will directors of public health get the data they need in sufficient detail to be able to address those inequalities and contact those who have not responded?
Minister.
I'm grateful for my honourable friend's question, and it's an incredibly important question, albeit in her region. They have done phenomenally well. I want to praise them because they've got 91.8% of first doses for the over 80s in the STP. But she raises a really important question. The NHS is already sharing data with local government. We need to make it more granular. We've brought in Eleanor Kelly into the deployment campaign, the ex-chief executive of Southwark Council, so that we are totally in line and integrated with local government, because they know exactly where those hard-to-reach groups are. But she raises an incredibly important point that is a big focus for me.
Now we go to Wiltshire. Dr. Andrew Murison.
The government has done brilliantly well in securing more than 350 million jabs, which is enough, all being well, to vaccinate the population at risk several times over. So given the UK's relatively enlightened cooperative approach to vaccine rollout internationally, in sharp contrast to the narrow vindictive nationalism of certain quarters in the European Union who really ought to know better, what trigger points and what timetable does my honourable friend envisage for the disbursement of our inventory of surplus jabs and the infrastructure necessary to deliver them to countries that are less advantaged than our own?
Minister.
I'm grateful for my honourable friend's excellent question. my absolute priority is to make sure that we have the inventory, as he quite rightly describes it, to be able to vaccinate all adults in the United Kingdom, offer them the vaccine, of course. And at the moment, we are nowhere near that. Supply remains the limiting factor in terms of our first target, which is 1 to 4 by mid-February, and then 5, 6, 7, 8, and 9 as soon as we can after that. And then, of course, phase 2 that we've been discussing today. But he's absolutely right that we have optioned 407 million doses now of vaccine. So once we are in a position where we can secure enough vaccine for the United Kingdom's population, we'll be able to then look at where else we can help with our vaccine supply. But also, we've put £1.3 billion into the combination of Gavi, the Vaccine Alliance, but also into COVAX. Part of that 1.3 billion is 480 million pounds approximately. That's going into COVAX, which is helping low and middle income countries with their vaccination programs as we speak.
Now we go to Manchester. Asal Khan.
Thank you, Madam Deputy Speaker. I was grateful for the Minister's support of the video myself and colleagues across the House with South Asian heritage produced to encourage take-up the vaccine across the UK's South Asian communities. He knows that there is a real concern about the impact of disinformation being spread both online and offline in Black, Asian, and minority ethnic communities. Worryingly, much of the disinformation appears to play on people's faith or their race. What work is he undertaking in conjunction with DCMS colleagues to tackle the spread of vaccine disinformation online?
Minister.
Thank you, Madam Speaker. I'm grateful and incredibly encouraged by my honourable friend's brilliant initiative with many colleagues across the House to deliver that brilliant video of South Asian MPs from different political backgrounds and traditions, all recommending that when their turn comes, then people should be taking the vaccine. We've been working across government. There's a unit in the Cabinet Office, which is the COVID disinformation unit that was set up in March, that works with the online, the digital platforms to make sure we identify disinformation, misinformation to them, and they should be taking it down immediately. My message to all of them, whether it's Twitter or Facebook or any of them, you must be responsible and play your part in taking this disinformation down as soon as we flag it up to you.
Now we go to the Cotswolds. Sir Geoffrey Clifton Brown.
Thank you, Madam Deputy Speaker. I'm sure my honourable friend would like to join me in paying a huge tribute to the NHS colleagues and volunteers who've rolled out the vaccine with such speed in Gloucestershire. But I wonder if you could tell the House this morning whether there would be any clarity on when the 9 priority categories are likely to be completed, and whether that will inform the government on how it can produce its roadmap for a rollout of the wider economy, as my businesses in the Cotswolds are desperate for clarity on that matter.
Minister.
I'm grateful for my honourable friend's question. I will certainly join him in thanking the NHS family and the army of volunteers. They have done phenomenally well. I can tell him that in his STP in Gloucestershire, 94% of the over 80s have received their first dose, 94%, which is pretty good going. He will know that we've built a deployment infrastructure that can deploy as much vaccine supply as we are able to bring in. A couple of Saturdays ago, we reached a record of just shy of 600,000 doses in a single day. That is, I guess, a demonstration of the capability of this infrastructure, and we continue to grow it, as I've announced today. And so it really very much dependent on vaccine supply. We have good visibility from here on to the end of March, and then beyond that, more volume coming through. And so my focus, I hope he will agree, should be on the mid-February deadline to vaccinate those top 4 cohorts of the most vulnerable. That's 88% of mortality. And if I can get that done by mid-February, then we've achieved a real milestone in our fight against this virus.
Now to Chesterfield, Toby Perkins.
Thank you, Madam Deputy Speaker. The vaccination centre in Chesterfield, the largest town in Derbyshire, is open for only 2 days this week. It will be open for a maximum of 2 days next week, because NHS England apparently imposed much smaller vaccination numbers on the primary care network hubs than the national centres get. The Derbyshire primary care networks are certain that they could achieve the Minister's targets if they had the same access to vaccines and to the national booking system that the national service gets. So can you explain why the national centres are prioritised over the local primary care network hubs in towns like Chesterfield?
Minister.
I'm grateful to my honourable friend's question, and the primary care networks have done a fantastic job in delivering this vaccine rollout, and will do so as we go through beyond the first 4 cohorts into 5, 6, 7, 8, and 9, and then the next phase. Of course, we want to make sure that people have choice, and he will know, well, I think he will know by 2 p.m., certainly when the next data publication is made, that his STPs reached 89% of the over 80s, which is an incredible achievement, the bulk of which has been done by the primary care networks. We will continue to support them. I want, through him, to send them my thanks and appreciation, and we'll make sure we redouble our efforts to make sure that they get the vaccine doses that they need to get through not just the first 4 cohorts, but then to go beyond that and be part of that, the deployment program for 5, 6, 7, 8, and 9.
And now Forest of Dean, Mark Harper.
Thank you very much, Madam Deputy Speaker. I'm very pleased the government has agreed that once the first 4 cohorts have their vaccine become effective from March the 8th, we can start unlocking the economy. Does the Minister agree with me that once the first 9 groups have been vaccinated, accounting for 99% of deaths and about 80% of hospitalisations, that would be the right time for all restrictions to be relaxed so that we can get back to living as normal and get our children back to school and the economy fully open?
Minister.
I'm grateful for my honourable friend, and no one more than he and the Prime Minister want to get the economy back open and functioning as we would expect it to be as soon as possible. So the mid-February deadline for top 4 cohorts, he quite rightly points out, is the middle of February. If you go forward about 3 weeks from there, that's when the protection really kicks in of the 2 vaccines. The 8th of March is the plan to reopen schools and then gradually reopen the economy. I think it's important to also wait for the evidence. We've got, as I described them earlier, the Vivaldi study and the Siren study, where we're able to see the impact of the vaccines on infection rates and on transmission. We're getting some really positive data from Israel and, of course, from the Oxford team, but these will be our own robust evidence to be able then to share with the House, as the Prime Minister said, on the 22nd of February, the roadmap of how we intend to open back up the economy very gradually.
And now up to Aberdeen, Kirsty Blackman.
Thank you. The UK government has pre-purchased 300 million doses for the population of 66 million, and low-income countries like Guinea have only received 55 doses for their entire population. Given that COVAX will only cover about 20% of the population in low and middle-income countries, can the Minister explain how the UK is going to step up and take part in this global Britain and ensure that those people in low and middle-income countries and developing countries are able to access the vaccine?
Minister.
I'm grateful for the honourable lady's question. Well, in a couple of ways. First of all, once we have enough vaccine supply to be able to offer the vaccine to every eligible adult in the United Kingdom, every adult in the United Kingdom, I should say, every eligible group in 1 to 9, and then phase 2, and then every adult in the United Kingdom, then we will look at our vaccine supply strategy. At the moment, we are nowhere near having enough supply to be able to make that offer. That has to be our priority. She mentions COVAX. COVAX is only part of the story for us in the United Kingdom. That's, I think, about 450 plus million pounds into COVAX. But we've put a total of 1.3 billion into the Gavi vaccination initiative. So we are absolutely, I think, the largest donor by certainly financially, but by money, but also by per capita. So we are making a big impact globally, both in terms of research, development, but also on the vaccinations to low and middle income countries.
I appreciate that colleagues have complicated answers to ask the Minister and complicated questions, and that the answers are therefore also complicated. But I must ask for a bit more speed now, because we've taken an hour. I ought to stop this item of business, but I'm not going to, because I appreciate there are important questions to be asked. Just go a little bit faster. John Howell.
Thank you, Madam Deputy Speaker. Let me offer first my congratulations to the Minister on achieving more than 10 million vaccinations. But I wonder whether he will comment on how soon it will be that I can wander down to my local chemist to get a jab, as I did, in fact, for flu.
Minister?
I'm grateful for his congratulations. I stand on the shoulders of heroes, Madam Deputy Speaker. It is the army of NHS family and volunteers and our armed forces who are doing the real heavy lifting in this deployment. I visited the Cullimore chemist in Edgware, a brilliant independent chemist who's delivering the vaccination programme. At the moment, the limiting factor is the ability to do 1,000 vaccines doses a week because of our finite amount of vaccine that we have. But as we get more volume through, I, like he, want to see convenience, so you can actually walk down the road to your local chemist, and I look forward to doing that with him, I hope, one day.
We go to Preston. Mark Hendrick.
Madam Deputy Speaker, we know that all vaccinations are captured in real time and populate GP records within 24 hours. However, only the aggregated data is provided to local vaccination leads when it is absolutely necessary that they receive the line-by-line data at citizen level to enable them to respond immediately to low uptake, for example, from BAME communities or accessibility issues in identified care cohorts. When will the Minister provide the detailed line-by-line vaccination data for local vaccination leads that is required to level up the fight against this deadly disease? And can he explain why it isn't already being shared?
Minister?
I'm grateful for my honourable friend's question. Is absolutely right. We need to share as much granular data with public health, local public health officials, and of course, making sure that local government can target, home by home, individual by individual, as soon as possible. I want to see the CCG level data published, and the NHS will be doing that very soon. And we continue to make sure that we work closely with local government to understand what additional data, and I mentioned earlier Eleanor Kelly joining the team from local government. That is exactly my intention, and he raises a really important question, because if we're going to target and reach the hard-to-reach groups in the BAME community, we need that information.
And now to Ludlow. Philip Dunn.
I wholeheartedly congratulate my honourable friend and all those involved in delivering over 10 million vaccines to the most vulnerable in our communities right across the UK, including the vaccination hub opened on Tuesday at Ludlow Racecourse, with support to the NHS locally from RAF medics and volunteers from Shropshire Fire and Rescue, Shropshire Council and many community volunteers. Could I ask the Minister to consider most carefully for those areas where deployment of the Pfizer-BioNTech vaccine proved especially difficult, such as primary care networks covering remote rural areas with small GP practices, sparse population and lacking suitable premises to host large numbers per day, such as in southwest Shropshire, where the deliveries of the Oxford AstraZeneca vaccine can be prioritised to ensure that the priority group targets are met?
Minister.
I'm grateful to my honourable friend for his question. He will appreciate the importance of maximising the vaccine available to GPs by both using Pfizer and the Oxford AstraZeneca vaccine. But in recent weeks, the volume of AstraZeneca Oxford going to GP sites has been higher than Pfizer, allowing the flex to visit the housebound care homes and deploy at individual practices in rural areas, as he quite rightly points out. Any site who wishes to discuss its vaccine allocation should discuss that with its local system in the first instance and thereafter with the NHS regional team. But very happy to take any specific examples away and look at them.
And now to Wallasey. Dame Angela Eagle.
Many thanks, Madam Deputy Speaker. The Minister was uncharacteristically coy in answer to his honourable friend, the member of the Cotswolds, about how he will kick on after the top 4 priority groups have been vaccinated. Will he give us a bit more detail about when he believes that all adults over 50 will have received their vaccination? Because clearly there are members of his own party that wish to open up maybe faster than that. And with over 1,000 a day still dying, we've got to make sure we make the right decisions, don't we?
Minister.
I will keep it short. My target is the mid-February target for the top 4 cohorts. Either I or the Secretary of State will be at the dispatch box to then share with the House the plan beyond category 4 into 5, 6, 7, 8 and 9.
And so to Aberconwy, Robin Miller.
Thank you, Madam Deputy Speaker. Will the Minister join me in thanking the staff of Betsy Cadwallader Health Board, our GP practices and the many volunteers who've worked so hard in recent weeks to deliver over 100,000 doses of vaccine across Aberconwy and a beautiful but rural North Wales? And can the Minister confirm too that the Public Health Wales body has received enough vaccine doses to vaccinate the first 4 priority groups in Wales by mid-February?
Minister.
I will certainly join him in congratulating the Betsy Cadwallader Health Board, the GPs, their teams and the many volunteers. And yes, I can confirm that Wales and the Welsh NHS will have received the allocation for 1 to 4 by mid-February for them to be able to do that. And I commend them for doing the work they're doing at the moment.
And now we go up to Westmoreland. Tim Farron.
Thanks, Madam Deputy Speaker. Unpaid carers provide a huge service to our community here in South Lakeland, but of course, especially to those people who they care for directly. And if they get ill, that's a huge welfare risk for those people that they care for. But there's been confusion over whether unpaid carers will be prioritised for the vaccine, because although the government said they would be in priority group 6, they are missing from other communications, including the summary list in the vaccines delivery plan. So I wonder if the Minister would now agree to clarify once and for all that unpaid carers rightly will be on the priority list.
Minister.
I'm grateful for my honourable friend's question, and we are absolutely looking to make sure that unpaid carers are on the priority list.
And finally, we go to Bosworth. Dr. Luke Evans.
Thank you, Madam Deputy Speaker. And lockdown has affected the mental well-being of almost everyone in this country. Now, the vaccine programme is going to mean the NHS comes into contact with almost every adult in the country. So with that in mind, will the Minister consider having a mental health worker at all the national vaccine centres to provide opportunistic mental health interventions should people need it?
I'm grateful for my honourable friend and his excellent and thoughtful suggestion. I will certainly take that away and discuss that with the Minister responsible in the department.
Thank you. We've covered a lot of ground. I'm now going to suspend the House very briefly for 3 minutes so that the Chamber can be prepared for the next item of business. Order!